Artificial Intelligence Dr. www.abcpharma.net/English. Why does a pacemaker implantation require a thorough clinical evaluation and consideration of several factors? What factors require consideration? Cohere AI. Pacemaker implantation is a significant cardiac intervention that carries potential risks and implications, which is why it requires a thorough clinical evaluation and careful consideration of multiple factors. These factors help guide the decision-making process and ensure the best possible outcomes for the patient. Here are some critical considerations. 1. Symptomatic status. The presence or absence of symptoms associated with the cardiac condition is a key consideration. Pacemakers are often indicated for patients experiencing symptoms like dizziness, syncope, fainting, fatigue, or heart palpitations due to certain cardiac rhythm disorders. 2. Type and severity of cardiac condition. The type and severity of the patient's cardiac disease, such as AV block or heart failure, determines the urgency and necessity of pacemaker implantation. 3. Age and life expectancy. The patient's age and life expectancy play a role. Older adults, especially those with multiple comorbidities, might have a different risk-benefit profile than younger individuals. 4. Other comorbidities. The presence of additional medical conditions must be evaluated, as they can interact with the cardiac condition and the pacemaker therapy. Conditions like kidney disease, liver disease, or diabetes require consideration. 5. Cardiac function. An assessment of cardiac function, including ejection fraction and cardiac reserve, helps determine the patient's overall cardiovascular health and their ability to benefit from pacemaker therapy. 6. Device indications and contraindications. There are established indications and contraindications for pacemaker implantation. For instance, some infections or certain types of heart failure might contraindicate the procedure. 7. Patient preferences and quality of life. The patient's preferences and their expectations regarding the impact of the procedure on their daily life and long-term quality of life are essential considerations. 8. Risk of procedure. The risks associated with the implantation procedure itself, including infection, bleeding, pericardial effusion, and device malfunction, must be weighed against the potential benefits. 9. Medical history. A comprehensive review of the patient's medical history can reveal potential interactions with current medications, previous surgeries, or relevant genetic factors. 10. Physical examination. A thorough physical exam assesses the patient's general health, heart rate and rhythm, blood pressure, and the presence of any cardiac murmurs or signs of congestive heart failure. 11. Cardiovascular imaging. Tests like echocardiography and cardiac MRI can provide detailed anatomical and functional information about the heart, guiding device placement and assessing the need for pacemaker therapy. 12. Device technology and programming. The choice of pacemaker device and its programming complexity must be tailored to the patient's needs. This includes considerations like single-chamber versus dual-chamber pacing and rate-responsive pacing. 13. Future cardiovascular risk. The patient's long-term cardiovascular risk profile is evaluated to assess the potential for future cardiac events or diseases. 14. Cost and availability. The cost of the device and implantation procedure, as well as its availability and reimbursement within the healthcare system, are practical considerations. 15. Surgical expertise. The experience and expertise of the implanting physician and surgical team are vital. The procedure requires specialized skills and knowledge of potential complications. By considering these factors, healthcare professionals can make informed decisions about pacemaker implantation, ensuring the best interest of the patient is served and optimizing their cardiac health and overall well-being.